My name is Shaeba Rizvi, and I have been involved in healthcare since 1992 in terms of education. So in 1992, I was in Pakistan, my native country, where I entered the medical program. So I completed a 6-year medical program by 98, after which I trained in neurology. It was around 2001 when I was in my neurology residency that I started to notice the benefits of physiotherapy with many of our stroke patients. And where medicine and surgery was not successful, resilient and constant exercise started to benefit people, and they were moving when we thought movement was impossible. That's when I realized the application of physiotherapy and the fact that there's still a lot more to do in this. And around 2002 then is where I started directing myself towards physiotherapy. The PTA-OTA program is a wonderful hybrid diploma program that allows a person the flexibility of working under the supervision of a physiotherapist or an occupational therapist as an assistant. The assistant is one whom provides most of the treatment. So when it comes to working under the guidance of a PT or an OT, then as a PTA-OTA you are providing the treatment. The OT or PT is providing diagnosis and treatment planning. So it becomes a good division of the labor and allows for an efficient system where you can spend more time with the patients treating them. So the PTA and OTA, they spend the most amount of time with the patient, usually more than the PT or OT. So the program is designed to cater to students who want to learn the theory and the clinical training to become a PTA and an OTA. So we spend about 18 months, which is a long time when it comes to these types of programs, but it's also very concentrated. So we do a lot of theory in about 14 months. Spending approximately probably a little more than a year, so a year and 2 months, in which we go through PTA and OTA theory. The basics of both sides of the theory are that we start with the basic sciences, where we learn about the human body and the main systems that work for us, like the muscular system, the skeletal system, the nervous system, cardiovascular and respiratory systems of the body, because they're all related to our physio and occupational therapy fields. And after that, we go on to the injuries and diseases and disorders that can affect the body in physiotherapy and occupational therapy patients. And then the third part of it is talking about the treatment, which involves rehabilitation and physiotherapy side and occupational therapy side in treatment. The theory is about 14 months, followed by 4 months of placement. In the theory portion, the student is in class and they are basically learning theory along with practicing their clinical skills. Then they further refine their clinical skills when we send them out to placement, and they spend about 4 months on clinical placement, further training under a physiotherapist and occupational therapist. It's a 4-hour class per day, and I try to run the classes in a way that you have time to listen to the discussion, ask questions, and also revise the material in that time. So if you utilize that time properly, that might be enough to get a basic understanding. Probably 1 to 2 hours a day more would be beneficial because it allows you time to revise the information, remember it. It is the health field, it is biology, it is pathology and treatment, so there's a lot of information we have to process in this field. Can I do this? Can I enter into this program? That's often a question. We often have people who are changing careers. We have people who are raising families and have been doing a different career for many, many years or decades sometimes. We get students anywhere from the range of 18 up to 70 probably. And one of the questions is, can I do this? So the answer is very simple. Yes, you can. And that's because the course is designed for that, and I'm also, that's my favorite challenge and my passion, which is showing somebody who perhaps thought it very difficult to understand the human body, to show them that it's quite doable and understandable. All you need to do is just have the right attitude and make the effort. And I find my main reward in teaching is when somebody's eyes light up because they understand something about the science of the body. It is enough time to build a strong foundation for the human body so that as you continue clinical practice, you tend to not go back to the books. You tend to not want to study. But in these 14 months, if you concentrate, then you can learn a lot, because we actually have packed in about 3 to 4 years of information into 14 months. So it's very intense. But I tell them all you have to do is have the right attitude, don't give up, attend classes, and ask me questions, and study 1 or 2 hours on the side.